Hello dear students, in this video we are going to continue with the regional circulation. In the previous video we discussed about cerebral circulation, and in this video we are going to see what are the special features of the coronary circulation. Coronary circulation, as all of you know, it is the cardiac circulation, the circulation or the blood supply which supplies the heart itself. So that is the coronary circulation. Let's try to understand what are the special features of it. So let's get into the topic, the coronary circulation. All of you know that the heart will supply itself first, then it will supply the rest of the organs. So as soon as the origin of aorta happens, so first the aorta will originate from the left ventricle, and after that it will immediately give the coronary arteries, that is the right and left coronary arteries, and the heart will be getting about the blood supply of 250 ml per minute, which is about 4% of cardiac output. This 4% might be low, but the oxygen extraction is very high. The amount of oxygen that will be uptaken by the cardiac tissue is very high. And again, during the time of severe exercise also, the same 4% will be given. So what will happen naturally to the cardiac output will be increased. So the 4% out of that increased cardiac output will be enough for the heart. So it is like a taxing system. Like first initial 4% the heart will take for itself. Whereas in the cerebral circulation, we saw it keeps the amount constant, but here it keeps the percentage constant. That is a very important feature of the cardiac circulation. And coming to the veins, the cardiac system will have the coronary sinus as well as the anterior cardiac veins, which will eventually, both of them will drain into the right atria. So this is a simple anatomical diagram, which you must have seen it in anatomy books also. From the left ventricle, the aorta will be originating, and the aorta will be giving the blood supply with the help of the coronary arteries, that is the left coronary artery and right coronary artery. Right coronary majorly supplies the right side of the ventricle, whereas the left coronary majorly supplies the left side of the ventricle. And the coronary left side, it will in turn give two important branches. One is the left circumflex branch and left anterior descending branch. So this is called as LAD and this is called as LCX. So these are the two important branches. We are not going to get into the anatomical details. We are just going to see what are the physiological or functional importance features of this coronary circulation. So coming to the features, first I already told you it has high oxygen extraction. This is one of the highest in comparison to most of the tissues. So it almost extracts 60 to 85% of oxygen. Whereas in other tissues, it is roughly around just 25%. It is actually a huge disadvantage for the heart, because now at baseline itself, the heart is extracting 60 to 85%. So during the time of workload, the only option to get extra oxygen is to bring in new blood supply or increase the blood supply to the cardiac tissue. Otherwise, it cannot extract the same oxygen from the given, because in one circulation itself, it is going to extract almost most of it. So the only option is to bring in more and more blood supply, which is actually not a good thing for the heart. That is why whenever the blood supply is compromised a bit, so what is going to happen? The heart will go for a myocardial ischemia. So it is very high at rest itself, and there is an increased O2 demand. What is going to happen? Primarily it is met by the increased supply, because it cannot extract further from the same amount of blood supply. Then the flow is phasic. For example, the flow is greater during a systole or a diastole in case of other organs. All other organs in the body will get majority of the blood supply during a systole, because during a systole, blood pressure is more and the organs will be perfused better. Whereas in case of heart, it is going to be different. So that is why it is called flow is phasic. What happens in systole and diastole? So it is going to be different in systole and diastole. Because during systole, what is happening to the left ventricle is the left ventricle is contracting. So the vessels inside the left ventricle is also getting contracted. So the left ventricle does not get majority of the blood supply during a systole. It gets majority of the blood supply only during a diastole. So this is very important. Many books write the heart itself will get major blood supply during diastole. Please do not go by their words, because still the right ventricle will get majority of the blood supply during a systole only. I will tell you the explanation for this with the help of the numbers, but don't worry, but try to remember, don't go with the general term like the heart will get its blood supply during diastole only. It's not like that. The left ventricle will majorly get the blood supply during diastole, whereas the right ventricle still will get majority of the blood supply during a systole. So this is one thing to remember. And majority of the books, sometimes they write one more thing also. The heart gets blood supply only during a diastole. That is also a wrong statement, because if it is not getting any blood supply during a systole, then obviously it will go for a myocardial infarction. So just remember this point. I will just come back to this again. Next, coming to the next point, it has poor collateral circulation. The coronaries behave like they are the end arteries. So what is the disadvantage of an end artery? They don't have any collaterals. Of course, the cardiac system has some collaterals, but the collaterals are not very efficient. They are inefficient. Even during a long-standing obstruction or any kind of stenosis happening, there will be development of collaterals in the heart. And while doing an angiography, there will be a lot of vessels which will be showing up. But again, they are not efficient. That's why out of a sudden block, suppose for example a double vessel block or a triple vessel block, what is going to happen? It will cause a massive myocardial infarction. So the collaterals are not efficient. It has a good autoregulation. That is one good thing. So the flow is regulated by oxygen demand. As and when the oxygen demand increases, the blood flow also will increase, because the 4% of the supply will be kept constant. And it has got a dense capillary network to facilitate the oxygen delivery, which is again very good. And it has got limited anaerobic capacity. So all the metabolism happens with the help of aerobic system. Heart needs a constant supply of oxygen. They always need a supply of oxygen. So that is why getting a good blood supply to the heart is always very, very important. Next, there is one phenomena called as coronary steal phenomena. What is this coronary steal phenomena is? Let's try to understand with two vessels. For example, there is one vessel like this, and there is another vessel like this. Suppose in one of the vessels, there is some obstruction which is happening. Now, let's assume both of them have come from the same main artery. Now, during the case of any kind of activity, for example, there is some activities happening. So, what will happen? The heart will require more blood supply. So, naturally, there will be formation of local metabolites. Now, this local metabolites will try to dilate the vessels. Because of the inherent nature, the one of the vessel was already obstructed. Even if you dilate it, it cannot dilate further. What happens is, this other vessel, which is normal, this vessel will dilate massively. Why? Because the local metabolites go and act on those vessels and they will dilate it massively. The obstructed vessels tend to be dilated at baseline itself, so further dilation does not happen. So what is happening to the resistance here? There is a decrease in total peripheral resistance. So what will happen to the blood flow is, since they were coming from the same major artery, the blood flow, instead of going to the area where there is obstruction, all the blood will be diverted to the normal vessel because of the resistance decrease there. So this phenomena is called as coronary steal phenomena. What the good vessel is doing, the good vessel is reducing its resistance and trying to get all the blood supply towards itself, thereby causing a very big disadvantage out to the area where there is already obstruction. So this is one phenomena which is happening in the heart, but again, here the good vessels, they are getting too much dilated and their resistance is low, and naturally they are stealing the blood away from the vessels which are already blocked. So this is again a disadvantage. So this is called as coronary steal phenomena. Next, the coronary reserve. The coronary reserve is extremely high. That is very good. It can get the blood supply up to 4 to 5 times than the resting levels. So from 250, it can easily get 1000 ml or around 1250 ml easily whenever there is a requirement. So these are all the special features of the coronary circulation. A small recap of it. So first, high oxygen extraction is there and flow is phasic, which we are going to discuss further also. Then poor collateral circulation. Then we have a good autoregulation. High capillary density, limited aerobic capacity is there. Coronary steal phenomena is happening here. Then coronary reserve is also good. Now coming to the pressure differences, like the flow is phasic, how it is different in left ventricle and how it is different in right ventricle. So we are going to understand through them with the help of this simple diagram. I told you to believe me that the left ventricle gets majority of the blood during diastole and the right ventricle still gets majority of the blood during systole. Let's try to understand. So suppose this is the aorta the aortic pressure will go up to 120 during a systole, and during a diastole it goes up to 80. And all of us know, suppose this is the ventricle and the aorta is coming out, and from the aorta only there is a blood flow which is coming to the ventricle, left ventricle. So the blood flow is coming from the aorta to the left ventricle. So if the pressure in the left ventricle is very high, what is going to happen? The flow from the aorta will not be able to reach the ventricle itself. There should be a lower pressure in the ventricle, then only the flow will come from the aorta to the ventricle. When the aortic pressure is 120 during a systole, what is the pressure in the ventricle? The ventricle pressure is also 120 only, or sometimes some books say it is 121. If the ventricular pressure is more than the aortic pressure, can the coronary arteries bring blood into the ventricle? Obviously no, because here the pressure is high. Suppose for example 120 force is coming in this way. Here also we are throwing 120. So what will happen? The blood will not reach the ventricle itself. The blood will not reach the ventricle itself. So when the pressure in the aorta is also 120 and in the left ventricle is also 120, obviously they will cancel out each other. The blood will not enter the ventricle itself. So the blood supply will not happen during a systole. Next, coming to the diastole. Diastole, the pressure in the aorta is 80, whereas the pressure in the ventricle it's almost 0. So now what is the pressure difference? So the pressure is 80 here and it is 0 here. So the blood will easily flow from the aorta via the coronary arteries into the ventricle. So the pressure during a diastole is 0. So what was the pressure difference here? The pressure difference here was around -1. So obviously it cannot do it. Here it is 80 minus 0, which is equal to 80 mm of Hg. This 80 mm Hg, which is in the aorta, will facilitate the blood flow into the ventricle during a diastole. Now you can ask me a question, sir, if the blood flow is happening only during a diastole, will the cardiac muscle have hypoxia during a systole? To prevent that, there is one backup mechanism. Obviously, the majority of the blood supply, as you can understand, like this 80 mm of Hg will help to supply during diastole one. What happens during systole is, the cardiac system has one beautiful type of vessel called a subendocardial arterial plexus. So these plexus, as you can see in this diagram, they are like wave pattern and they are inside the muscle. So when the ventricle is going for a diastole, what is going to happen? The blood is going to enter and they are going to be stored in it. Now this is the musculature surrounding it. If the muscle starts to squeeze during the time of a systole, what is going to happen? It is getting squeezed, but whatever blood is there inside it, that will be transmitted through the minute vessels. So as you can see the branchings over here. So the blood that is filled here will be pushed into these vessels during the time of systole. So this subendocardial plexus will help to supply the heart during a systole. So the blood supply is not zero. There is some subendocardial muscles which are subendocardial plexus which will receive the blood during a diastole and help to push that blood into the musculature, because this is inside the muscle. So this is the muscle and it is inside the muscle. So when it compresses also, this blood will be squeezed out and supply the ventricular musculature. So that is important. So now we have understood, like diastole, we are having a greater pressure in case of left ventricle. Now coming to the story of the right ventricle. So here the pressure is 120, obviously in the aorta, and 80, similar. What is the pressure in the right ventricle during a systole? The pressure in the right ventricle is not 120 because right ventricle pressure is very less. 25 mm of Hg. What is the pressure in the right ventricle during a diastole? It's 0. Now let's see the pressure differences. So during a systole, what is the pressure difference? It is 120 minus 25, which is equal to 95 mm of Hg. What is the pressure difference during a diastole? 80 minus 0, which is around 80 mm of Hg. Now you guys are going to think and tell me, during which duration the pressure is more? During a systole, the pressure availability is more, the pressure difference is more, so that obviously the right ventricle gets better perfused during a systole, because the right ventricle is trying to contract, but the pressure from the aorta is very high. So the coronary artery pressure is also very high, so they will be supplying them during a systole itself. Whereas in the diastole also they will get a good blood supply, but again who will has a more pressure difference is during a systole. So that is why the right ventricle gets majority of the blood supply during a systole more than diastole. So this is the catch here, right ventricle and left ventricle. So the same thing is shown in the graphical manner. So the above diagram shows the aortic pressure. The aortic pressures are usually around 80 and it goes up to 120. When the aortic pressure is rising and the ventricular pressure is also rising, so the left coronary, you can see there is a drastic drop in blood supply during systole. Then after that, there is a slight increase. The subendocardial plexus will supply it. But you see the steep rise during a diastole. This steep rise during a diastole is because now it is getting a pressure difference of 80 mm of Hg. So the left coronary gets more blood supply during diastole. So this period is nothing but a systolic period and this period is nothing but a diastolic period. Now coming to the right coronary, as you can see here, there is a steep pressure rise and this is more during, the blood supply is more during a systole than a diastole. Both the time it is getting a blood supply, but higher amount of blood supply is being available during the time of a systole only. So the same pressure differences are given here, aorta, left ventricle and right ventricle. During a systole, the aortic pressure is 120, the ventricular pressure is, left ventricle is 121, the right ventricle is 25. As you can see, the pressure difference for the left ventricle, it is -1. So that's why we are not getting majority of the blood supply. Whereas in the right ventricle, it is 95. Below we have 80. Whereas in diastole, both the ventricles are 0. So it is 80 and 80. So the same thing, I have given it in a tabular form. So this one major difference in how the blood supply is phasic is very classical in case of a coronary circulation. So this is very important. So what are the methods to assess the coronary blood flow? All the methods we have already discussed in the discussion of the cerebral circulation itself. The KT method is called whenever nitrous oxide is used. Then the radionucleotide, thallium method can be used or a coronary angiography can be done. So these are the methods through which coronary blood flow can be assessed. I hope it's clear. Thank you for watching the video. If you have any doubts, please do drop it in the comment section. I'll be happy to assist you. Thank you so much. Keep watching and sharing with your friends.